Hello everybody, and welcome to my channel, Fertility, Hope, and Healing. My name is Dawn and I'm a licensed acupuncturist and fertility coach, and I help couples achieve their dream of having a baby. And if you're interested in checking out some of our fertility programs, you can go to our website at lifeharmonywellness.com. Today, guys, we're going to be talking about ovarian cysts. I will be going over what ovarian cysts are, the two types of ovarian cysts that are pretty frequent, and the ways that you can actually get tested for ovarian cysts and signs and symptoms to know if you have an ovarian cyst. And also, lastly, most importantly, I'm going to go over 4 ways that you can treat cysts naturally. So first and foremost, let's go over what exactly an ovarian cyst is. An ovarian cyst is a fluid-filled sac on the ovary. Some of these cysts may disappear naturally, and others may stay longer. If they stay for more than a few months, they actually can affect your fertility. It really depends on the type of cyst that it is, and you will want to actually monitor it if you've ever gotten diagnosed with a cyst. Many actually don't even know that they have a cyst. So there are certain signs and symptoms that may tell you that you may have a cyst, and one of them would be like lower abdominal pain, also pain during the time of ovulation. If you have any spotting or bleeding around ovulation, that could be an indication that you have a cyst. If you have any bloating, or if you have any indigestion, and more bloating typically happening later in the month after ovulation or around ovulation, and then frequent urination or any pressure around the bladder. If you have pain around intercourse, these are signs and symptoms that you may have a cyst, and you will want to go and actually get that checked out by your healthcare provider. And the way that they actually test to see if you have a cyst is by doing a pelvic scan or an ultrasound internally to check your ovaries and see if you actually have a cyst. So there are 3 types of different cysts that you can have. Really, there's just 2 types, but one of the types is like polycystic, meaning you have many cysts, more than one, but that's a diagnosis that you can have. But the 2 types of cysts that you can have is the corpus luteum type cyst or the follicular type cyst. Now, the follicular cysts, these are fluid-filled pockets that form around your ovaries, typically around ovulation, and usually an egg is involved with that. If an egg isn't released, then typically that fluid-filled cyst, the follicular cyst, will just naturally burst on its own and won't be a problem, okay? Then the second type is the corpus luteum cyst. Now, this type of cyst typically would develop and then burst around the time of menses. But if it doesn't do that, this is the one that can be kind of pathological, meaning that it could be a problem, okay? And typically it occurs when there is an imbalance of your hormones. So this is something that actually needs to be watched on a regular basis. If it doesn't go away within a few months, you may need to actually get that treated. And the types of treatments that they have are usually they will just wait and see if it actually goes away on its own, or they will also do a surgery to remove it, and that's typically if they think that it could possibly be cancerous, because there are a few cysts that can develop into a cancerous tumor. So that's why they really want you to watch those and get scanned regularly every few months to see if it had disappeared. The other way that they treat it too is through birth control. And birth control, the reason they put you on birth control is because they will want you not to ovulate, and in hopes that that cyst will go away around your ovaries, okay? And it does work to reduce the cyst, but a lot of times it doesn't necessarily get rid of them completely. So yeah, that's the way that our conventional medicine will actually treat it. And I can work with anyone, you know, in this area, because I have had really, really good success at helping women reduce their cysts and get rid of them. And I've worked in age ranges from teenager all the way up to menopause with this type of condition. So I have been very, very successful at helping women get rid of their cysts. And it really becomes a problem with their ovarian health, because a lot of times too, their periods can stop. They can have anovulation. Those are some other signs and symptoms too, that you may have a cyst. If you're not ovulating, you may want to get that checked out, okay? So there are 4 ways that you can do to actually help get rid of cysts, all right? So one of the ways, because I'm a licensed acupuncturist, is acupuncture. Acupuncture helps to regulate your hormones, and it really is only one part of the picture of what it is I do. Most of the work that I do in my fertility program is with herbs, supplements, dietary, which are the other ways that you can use to actually help get rid of your cysts. So these are the ways you want to pay attention to, but acupuncture is only one part. Acupuncture will bring a lot of blood flow down to that area. It will help unblock blockages and somewhat regulate your hormones, because it really helps to decrease cortisol in the body and put you in a parasympathetic state when you're in those needles. So it's really calming and less stress when you're, over time, you'll feel less anxiety, less stress when you're getting acupuncture done on a regular basis. But what will really, really help, guys, is the dietary changes, the supplements, and the herbs, okay? So let's go over some of the supplements you can use. Supplement-wise, there really isn't a lot. It will be probably more specific to you and what you're going through, but the 2 main things I can recommend would be to increase your fiber intake. So do some type of psyllium husk fiber. That helps to draw out toxins. A lot of times cysts can be very much toxin related, okay? Because toxins, as I mentioned before in many of my videos, they are hormone disruptors, okay? So exposure over time can cause an imbalance of hormones. And there may be things that you are doing that are actually preventing you from being able to get pregnant. Eating genetically modified foods, or eating too much soy. And a lot of times soy is genetically modified. So you want to watch that, you know, when you're trying to treat a cyst. But fiber will help draw out toxins out of the body, and you can take that at night before you go to bed, along with probiotics. Probiotics and fermented foods are awesome for fertility health in general, and may help also in kind of on the backside of treating cysts. I personally like taking fermented foods all the time. So let's go into the dietary changes that you want to do. And I have an entire video I've done on this that I will link below in the description. So really, when you're looking at diet, you want to, again, avoid as much chemicals and toxins as much as possible, and eat a organic, whole food, plant-based diet with a little bit of meat, you know, animal products sprinkled here and there. But the biggest thing that I promote with my fertility reset diet is to stay away from those foods that typically cause a lot of problems with people allergy-wise, like dairy, wheat, sugar. The reason why, and soy too, soy is important to stay away from. Why? Because these are inflammatory foods, okay? And inflammation in your body, your eggs will inflame, all right? They will be subject to inflammation. So you really want to stay away from those foods that could be causing more stress in your body, more stress on your fertility health, okay? And avoiding those foods that, honestly, I personally think some of these foods can be directly related to cysts, like, you know, soy products. And I have my own personal experience with that, with going off of soy products. I used to drink soy milk all the time, because I've been off of dairy for years, and then I started to go more organic, and I was able to also take some herbs and get rid of my cysts that I had developing for the first time ever, and I've never had them since. I only had that once happen in my, as far as I know, in my fertility health. So, but yeah, you know, just if you can, the more good that you can put in your body and the less that you can avoid that's bad for you, the better you're going to feel all over, you know, energy wise and also hormonal health wise. Okay, so but there are certain foods that you can add that would actually help your fertility. And again, I mentioned this in that video, but just as a brief description of what foods that would be great for, specifically for getting rid of ovarian cysts, is cruciferous vegetables. Cruciferous vegetables, what they will do is they will attach to, like a lot of us are imbalanced in our hormones and have too much estrogen dominance going on, specifically phytoestrogens, which comes from the chemicals that we are ingesting or exposed to, and they will have receptors that attach to these phytoestrogens and draw them out. So they have a lot of great studies on that if you want to look into it. So cruciferous vegetables include broccoli, cauliflower, Brussels sprouts. Yeah, there's a whole bunch of them, and be sure that you and your partner are eating cruciferous vegetables if you're wanting a baby, because it's really, really important to your fertility health. So kale is another one. So definitely you can juice kale, you can, you know, put it into smoothies or steam it and put it in some soups. Really good for you. The other vegetables I really like for fertility are yams. Yams are awesome for fertility health, and they actually increase progesterone, and in so will help you with ovulation. So eat your yams, specifically eat them more during the last 2 weeks of your cycle, during the luteal phase. Really, really good for you. Well, you can eat them anytime, really. And you can make all kinds of recipes with yams that are very good for you and very yummy. The other thing is avocados and pears are really going to be good for you also. And red foods are really good for fertility health. Now, I mentioned before probiotics. I like fermented foods, and I actually have this right here I want to show you. This is gut shots, and this in particular is ginger beet gut shots. It's red, and guys, you can just drink this, okay? And that is awesome. It actually tastes pretty good, okay? So that's the ways you can help your fertility health, is by diet, by supplements, and herbs, and acupuncture. So acupuncture, you need to find an acupuncturist in your area. I'm here in Arizona if you're interested, but the herbs are really specific to you. I would have to actually prescribe this for you. I have a great cyst blend that I make up specific to you. I make the formula specific for you and whatever's going on with you. But anyway, guys, I really hope that you enjoyed this video. If you like, please give this a thumbs up. Comment below if you have any questions, and you can join our community by subscribing to this channel. And check out again our testimonies about cysts at lifeharmonywellness.com. And you can also follow us on Instagram at Fertility, Hope, and Healing. Love and blessings, guys, on your fertility journey.